Mandatory overtime is a big issue at Northside Medical Center. Nurses don't like it, but the hospital says it's not as bad as the nurses union wants you to believe. 27 First News reporter Gerry Ricciutti heard from people on both sides of the issue today.
As union leaders and managers conclude a two-day arbitration hearing inside Northside Medical Center, members of the Youngstown General Duty Nurses Association claim administrators are using contract language to create a loophole to force members to accept mandatory overtime.
It still doesn't mean that it's the right thing to do. What they need to do is hire more nurses, bottom line.
Nurses say their agreement, which expired in February and has been extended twice since then, prohibits forced overtime, requiring the hospital to pay workers triple their salaries for the extra hours.
We see it as a penalty and a deterrent to the hospital. We don't want them to use this. We don't want mandatory overtime.
In a written statement, officials with community healthcare systems, Northside's owners, say forced OT is used only in what they call extraordinary situations, adding out of 217,000 hours worked this year, less than 1,500 were mandated.
It should not be excused by saying it's a small percentage of overall hours. It should be zero, absolutely zero.
While managers tell us staffing is based on patient volume, union members argue their numbers have fallen from 410 nurses just a year ago to 290 now.
They already know, as we call them, holes, that there's a lack of nurses. They know ahead of time, even days ahead of time, that they are short for a shift.
There were shifts that could not be covered because nurses were working their maximum days, and there was just nobody else to put on that shift.
While nurses have another negotiation session set for this Friday on a new contract, they admit it could be months before the overtime arbitration is decided. For now, they're asking the public to pressure administrators into making changes. In Youngstown, Gerry Ricciutti, WKBN 27 First News.